Welcome, everyone. Assalamu alaikum. Thank you so much for joining us this afternoon. My name is Petra Al-Sufi. I am the Senior Outreach and Partnerships Manager at the Institute for Social Policy and Understanding. I want to thank our audience, our supporters, and our panelists for joining us. ISPU is a education and research organization that's nonpartisan, that does research and education to inform decisions in dialogue on American Muslims. This research was conducted by the Institute for Social Policy and Understanding with generous support and partnerships from IFANCA, who's represented here by Asma Ahad, who's going to share more on the work they do with us later. And so let's get started in this conversation. Halal food and food insufficiency in the US or among American Muslims. Decision makers charged with food programs in the US institutions, from educations to incarcerations, must consider the needs of all those who serve, including religious minorities who observe special dietary laws. Halal and kosher guidelines, respectively, are more than health preference. They are matters of sincerely held religious beliefs. US Muslims are projected to be the second largest faith community in the country by 2040. And according to new ISPU's research, which we'll be talking about today, the vast majority care about and observe halal guidelines in their purchase. So what is halal? I will briefly share here that halal is an Arabic word meaning lawful or permitted. The opposite of halal is haram. For many in the Muslim community, halal refers to their choices when it comes to food choices, where they eat and how they eat it. And it is a religious belief, not just a cultural preference. Sorry. This report is looking not only at halal, but also food insufficiency. And according to the USDA, food insufficiency means households sometimes or often did not have enough to eat. And the household pulse survey, food insufficiency is measured in the last 7 days. So in a week time, did your household have enough food to eat? So those are basic definitions. There's a lot more, but this is just to keep in mind as we have this conversation. So what are the results of the survey and this analysis? We found that most Muslims prefer or require halal when making food purchases. And you'll see here our comparison is often between American Muslims and American Jews. And the reason for that is the similarities between the two communities in terms of size, in terms of religious practices, and also similarities between, in terms of like historical patterns here in this country. So the majority of Muslims, 83% in the US, keep in mind, this is just looking at the domestic needs of American Muslims here in the US, either prefer or require keeping a halal diet. This compares to roughly a third or 35% of US Jews who say the same about keeping kosher. This breakdown to 37% of Muslims reporting that for all products that require halal certification, they only purchase halal certified products. 46% who say they mostly prefer halal certified food, but do not purchase some foods without certification if they're not blatantly haram. Muslims most likely faith group to be food insufficient, on par with Black and Hispanic Americans in the general public. So as mentioned, food insufficiency refers to not having enough food to eat in the last 7 days or in the last week. 1 in 10 Muslims reported they either sometimes or often did not have enough to eat in the last 7 days. And remember, one of our other research referred to about a third of American Muslims actually live at poverty level. So there's that connection. This surpasses Jews who report 1%, Catholics 2%, Protestants 4%, and the general public at 5%. It is on par with Black Americans who reported 8% and Hispanic who report 10% in the general public, as well as non-affiliate Americans. Okay, and we'll talk about recommendations toward the end. The majority of food insufficient Muslims require or prefer halal. So when we looked at those who are food insufficient or who did not have enough to eat in the last 7 days, the question was, do you prefer to keep halal diet even though you don't have enough to eat? And the majority still said yes. So 40, you'll see here that majority of American Muslims who did not have it still prefer to keep a halal diet, even though they did not have sufficient food. So despite the higher cost and comparative difficulty finding halal food, Muslims who reported being food insufficient were as likely as those who had enough food to always or most of the time say they do not keep halal. Additionally, Muslims who are food insufficient are as likely as those who have enough food all of the time to require or prefer halal certified food. This underscores the need for halal options in food assisted programs. So it's not just consumers being able to purchase halal food when they're able to, but when there are food assisted programs across the country, an additional layer to not only providing food so people have access and sufficient food to eat, they need to have, religiously appropriate halal food to eat or halal food. Students are as likely as non-students to be food insufficient. So we looked at students and non-student populations among American Muslims, and we saw that most students are as likely as non-students to be food insufficient. So that's something for college campuses to keep in mind. This survey was for those 18 and above, and we're not looking at K-12 yet. Most Muslim students require or prefer halal more likely than non-students. So again, looking at the student population versus non-student population, we saw that student population requires or prefer to keep a halal diet. Again, another note for education sector, for those who are involved in student life or in the experience of students on college campuses. And then majority of older Muslims prefer or require halal. So one thing that we saw is across the board, Muslim Americans prefer to keep a halal diet or require a halal diet. And especially those we're looking at students, we're looking at non-students, and we're also looking at elders. And across the board, there's a preference for halal or a requirement for halal. And this one we want to emphasize here, not only for the food assisted programs, but also for senior service programs and those who cater to the needs of senior Americans. And then older Muslims are the least likely age group to report food insufficiency. We looked at food insufficiency among different age groups, and you will see here that older Muslims are the least likely to report food insufficiency. Younger American Muslims 18 to 29 and middle-aged 30 to 49-year-olds Muslims are less likely than their elders to report having enough food they preferred in the past week, while 61% of both younger and middle-aged Muslims said they had enough food they liked in the past week. 75% of older Muslims said the same. So what are the implications on all of this? And our panelists will dive into that a little bit more. But the implications here is, of course, for business. This is a huge opportunity for businesses, especially as the American Muslim community continue to grow and continue to advocate for halal food. This is a huge opportunity to cater to that community. The vast majority of Muslims of all walks of life require or prefer eating halal, which refer to religiously prescribed dietary guidelines, meaning if that's their preferred requirement, they might avoid businesses that are not catering to that. So that's a lost business opportunity. Halal and kosher dietary guidelines share some similarities, but are not distinct in significant ways. Observing one does not meet the requirement for the other. And that's true across the board, whether it's businesses or any of the other service programs. Widespread halal preference presents an opportunity for new products and services and a need for more culturally cognizant social services. Education, food assisted programs must be visible on university campuses and offer halal certified options. It also means that campus cafeterias should consider providing halal certified choices to meet the needs of their student body. Elder care, halal dietary needs must be considered in elder care programs. And I know this is something that as more American Muslims consider elder care for their family members, it's one of the areas that they will be paying attention to programs and facilities. And then in general, there's a lot to consider here, but the point is the vast majority of Muslims of all walks of life require or prefer halal, which refers to religiously prescribed dietary guidelines. Halal and kosher share some similarities, but are not the same. Observing one does not meet the requirement for the other. Halal dietary needs must be considered in all contexts where people are given food, including but not limited to educational setting, healthcare institutions, food-assisted programs, disaster reliefs, prisons, and elder care programs. And for more information on all of this and other work that we do, check our website, and we will share some of those links in the chat here. And I'm going to invite our guest right now to join us as I introduce them and we move into a conversation about what all of this means and what's being done. And I will invite all of you to continue to share your questions in the Q&A box. So let me introduce I have efforts in the US and abroad to create awareness and provide solutions for halal consumers. IFANCA, she has built key partnerships with global and national leaders such as UNICEF, the American Academy of Dietetic and Nutrition, and the National Association for College and University Food Services. I'm also joined by Ben Marcus, who joined the External Affairs team at the USDA Food and Nutrition Services as the Presidential Management Fellow in May 2022. He's currently on a detailed with the USDA Center for Faith-Based Neighborhood Partnerships. He has spent most of his career as a constituent management professional and a nonprofit consultant with nearly 20 years of civic engagement, advocacy, and network development experiences. And finally, I'm joined by Radwan Abdurrashid, who is a sophomore at Loyola University in Chicago, where he's studying political science. Radwan and his family were refugees from Malaysia to the Chicago area, and he joined to talk about his experience as a student in one of the efforts he led as a high school student. Welcome to all of you. I'm going to start with the first question to Asma. Asma, what is halal certified and why is it critical? And also beyond food, what else are we talking about?
Assalamu alaikum, Petra. Good morning or good afternoon, everybody. As Petra introduced me, my name is Asma Had. I'm from the Islamic Food and Nutrition Council of America. We're one of the largest halal certifying bodies in the US and the leading certifier globally. And we're a not-for-profit organization. And I just want to start off to preface what I say so you guys understand the context and where we're coming from in this conversation. IFANCA is a leading advocate and a thought leader in the halal space in terms of defining guidelines and being recognized globally. We also are very passionate, and part of our mission, or a core to our mission, is promoting food security and health equity. And this is demonstrated not only in our commitment to our communities, but to the broader community, global community, and national community at large. We believe food security is important for Muslims, but it's important for the population at large. Is the endowment that IFANCA gave to Texas A&M University to start the first food diversity program in the country, where we look at the dietary needs of everybody, not just Muslims. We look at the diet. We have the food diversity program there highlights the needs of people who are gluten-free or have allergies, people who observe kosher, people who observe halal. So the next generation of food scientists or nutritionists that go through this program are well versed in understanding of the needs of people, because we understand that food is sacred. Everybody needs to eat. That's a basic right and a basic need, and that people should know how to service people when they have specific needs when it comes to food. So that's just a little bit of background on our organization and our commitment to food security and equity to everybody, not just Muslims. But our area of expertise is halal, and I want to talk a little bit about what halal is. As Petra mentioned earlier, halal literally in Arabic means permissible. And when people ask me, what is halal? I like to say everything is halal with the exception of the things that are not permitted in Islam. And there's 6 key areas that we like to highlight, that things that are not permissible. The most common things that are not permissible that are found in our everyday foods are pork and pork-derived ingredients. And then the second most common thing is alcohol in the different forms it comes in. So those are the things that we really watch out for. There's other things that are not permissible in the 6 areas that we've defined as not acceptable. And some of those are like eating a carnivorous animal or drinking blood. And those things don't happen on an everyday basis, but you might find some of those byproducts seep in through the supply chain through ingredients, and that's where it becomes critical to know that. The other piece that's very important is that any form of cross-contamination with anything that's not permissible within the halal diet deems any product that's being served, cross-contamination makes it not halal. So that's a quick summary of what is halal. And I say this, and I want to make a clear distinction because a lot of times people come to me, and a lot of times people who are like food service providers or so on and so forth come to me and say, "Oh, we do halal. We have a halal certified protein." And what I love to say to those folks is the halal is not a piece of meat. Halal is a total compliance program, like you would have a compliance program to observe allergens or gluten-free or kosher. Halal is an institution, and it's a compliance program that starts from the point of procurement to the point of delivery. And sanitation and cross-contamination are also key parts of that conversation. So that's in a nutshell what halal is. And another common question I get is, what is the difference between kosher and halal? And people often sometimes think it's interchangeable, although there's a common basis of understanding of what's driving consumption, which is religious faith and guidelines laid out by your faith. There's several differences between kosher and halal. For example, kosher permits the use of alcohol. Some other thoughts in this area are around fish, shellfish, acceptability. In halal, there's no restrictions around meat and dairy, and there are restrictions with kosher, and there's other restrictions around supervision with kosher that are not there with halal. And the compliance program that would be implemented with halal would be very different than something that I've seen from kosher programs that have been implemented. So what does it take to implement and to meet the needs of halal consumers from a food and Islamic jurisprudence perspective? There's 3 things that we really need to pay attention to. And the first thing is we need to have clear guidelines that are laid out, that are informed by people who are in the space, who are experts in the space. I often get, "Oh, we talked to, the Muslim students on campus, or we talked to so-and-so person at the mosque, and they said that this is acceptable and this is not." There is specific jurisprudence around what is acceptable and what is not acceptable as it relates to halal, and there are religious experts in this space. And IFANCA regularly works with many of the leading experts, both in the US and globally, to help guide us in the guidelines we create in the conversation around what's acceptable and what's not. When we look at building out the conversation for institutions, once we have clear guidelines, we need to train, just the way we are working with Texas A&M to train the next generation of food scientists, nutritionists on what is halal. We need to work on training our supply chain on how to handle and manage halal, and making sure, especially the people who are handling food, how this needs to be executed. And finally, on a regular basis, we need to continue and have oversight in the space so that halal guidelines are being followed properly, just the way you would have with any other compliance program. So I tried to consolidate a lot of this conversation. One of the things I probably missed saying about IFANCA is a not-for-profit organization, and we are dedicated to promoting halal, promoting food security and health equity for everybody. But we are a compliance organization that is made up of experts in Islamic law when it comes to food. And then the other team that we have on staff are a team of experts that are in food science, whether it's animal proteins, food ingredients, so on and so forth. And we come together to make sure that the needs of Muslim consumers are being met.
Thank you so much, Asma. There are a lot of details on all of this included as part of the report, and the link to IFANCA will be posted here for you all to just follow the work and see what their work encompasses. Because again, as Asma mentioned, it's more than just the food that we eat. It's include the nail polish we wear on our fingers, and so much more. I'm gonna move to Radwan. So Radwan, when you were in high school, you led initiative to address halal food in your high school. Can you tell me what motivated you to do that, and what was the impact of not having access to halal food on your in your high school? How did that impact the students?
Of course, a couple things that motivated me to do this student-led project was one thing. Most of my friends, when I have a couple Muslim friends back in high school, and when we talk about halal, and some of my friends be like, "What is halal?" So they don't know what is halal, first of all. So that kind of motivated me to teach them what is halal and stuff. The second thing was when my teachers started complaining, saying, "Oh, you guys are low on energy, you guys don't participate, this and that." So that's kind of what motivated me to do a change throughout the community. If my mindset was, if I don't take advantage of this, then who would? If I don't take a step forward this, who would? That was what motivated me. And then I went and talked to my social worker. His name is Joshua Zapata. He was like, yes, then you guys could lead a student project, which I collected data during a survey throughout the high school. And I still have the slides and everything. I asked a question saying, how important is halal to you? And most of them said 87.9% say it is very important for them. So that's a big thing. And then I did a research through Airmark website, and they said that most they will cover what's the needs for all the students, and they don't do that for Muslim students. We need halal food. And then I just drop a question to them. Is it is it equitable to deprive Muslim students access to halal food? And from then I was proud of it that I could do this, and it keeps motivating me to do a change and see. Even though I could not back in high school, even though I couldn't eat halal food, but the next generation, the new generation who's coming, Afghans refugees, Rohingya refugees, and there's more immigrants who are coming back in high school to Chicago. They don't speak English, but they have access to halal food. That's what kept me going, and that's what made me to do this project.
Thank you so much. And I know in our other research that look at American Muslims' religiosity, or looks at how they value their faith, we see that young American Muslims, unlike their peers in the general public, actually state that their faith is really important to them and it's a source of happiness for them. And we also know that young American Muslims face a lot of challenges, including religious-based bullying, where close to half of American Muslim families report having a child in the public school who was bullied because of their religious belief in the last school year. A fourth of those cases are at the hands of adults in the school system. So there are a lot of challenges that American Muslim youth already face, and I could just imagine what halal food, which is part of their religious dietary need, might make the process and the experience a little bit easier for a community that's already struggling. So thank you for that, Radwan. Ben, the question now moves to kind of looking at a higher level. So we have student activists that are doing this work in high schools, college campuses. We have organizations that are providing the resources and doing certifications. I'm interested in knowing what is being done at the national level, especially that we clearly see Muslims across the board, but especially young American Muslims, clearly expressing they prefer to consume halal food. And we know that most young people spend their time in the school settings where they consume their meals every day. So I know there are a lot of programs to address food insufficiency in the community, ensure that students not only have access to food, but access to halal food or religiously appropriate food for their community.
Yes, thank you so much, Petra. I really appreciate it. And I really appreciate the introduction and opportunity to be here today. The short of the long is, especially under this current administration, a real focus on equitable access to our programs at USDA is a top priority. And not only religiously informed dietary communities, but across the board. The reality is that every citizen and resident of this country deserves equitable access to programs and benefits that are offered by the federal government to support people when they need help the most. And at USDA, it's no exception. And so, there has been a lot of work done on this over the last year and a half to almost 2 years of internal and external research to really uncover what the real barriers are to access. I'm sure a number of people on this call, certainly fellow panelists here, were a part of those early conversations. And I am really happy to say that we are rounding the bend at this point to really identify specific recommendations and actions that USDA can take, and looking for internal clearance to move forward on those. So it has been an unfortunately long project to really get to a point where we're at an actionable place. But the reality is that, sometimes in government, it's about, crossing those T's and dotting those I's, 5 times before you're ready to move on to the next step. And so there is a significant need that we have certainly identified, and the research that I'm hearing today here is absolutely not surprising to me. I think you'll find at Food and Nutrition Service specifically, but certainly at USDA across the board, a whole lot of folks who are incredibly mission driven, who really do want these programs to be accessed by the largest number of eligible people possible, and we're willing to do whatever that takes. So, without getting into specifics, because these haven't received clearance to really say the specifics, we are looking at recommendations across a variety of areas, including the opportunity to help develop educational resources, provide technical assistance, provide resources, hopefully provide changes in policy in other areas that can make it a lot easier for local agencies that are serving substantially large Muslim and Jewish populations to receive the resources they need to properly serve those communities. So we are looking at a serious cross-cutting set of recommendations, and not just at Food and Nutrition Service, but also in other parts of the department. I mean, as you can imagine, the issue of access to kosher and halal foods doesn't just stop. It's not just an issue of whether or not those items, are available through our feeding programs, but it is also an issue of domestic production and of supply chains for these products. Not to get a little bit too far into the weeds, but because of some government-wide requirements to buy American and these other sorts of things, the foods that can be offered through USDA, right, also have to follow those guidelines. So there are all sorts of specific things that we are looking at developing supports to really help solve this problem in a holistic fashion, and just really really appreciative for all the partnership that folks in the halal community and in the kosher communities have really helped us get to this point. So hopefully in the next couple of months, y'all will be very excited about recommendations that we're moving forward with. And I wish I could share the specifics right now, but we're in this really sensitive place. But I really appreciate being invited here today.
Thank you, Ben. Just a follow-up question. Will these recommendations be publicly available, or are they more internal?
Well, right now they're internal,
Okay.
but after we get, it's a long process that includes multi-layered, approval to really give the green light on some of these things, because it requires some, commitment of resources and other things that have yet to really be there. I would imagine some of these we can get moving on much quicker than others, right? And so it'll probably be a trickle of things starting to happen sooner rather than later.
So can we talk about what is needed across the board to support a halal market in this country? that's also affordable. I'm gonna start with Asma and then Ben and Redwan, let me know if you want to come on.
So a lot of folks come and ask me, and we actually had a great discussion. And we were in Maine last week. Maine schools are looking to start a halal food service program for their halal observant students there. And you have to start by having clear guidelines that you follow, because the question often comes up of what people define as halal. Like, is your halal my halal? There's so many Muslims, when it comes to halal, there's a different levels of practice. And so if you have clear guidelines that are accepted by the vast majority, then that will help us create a solid halal market, the one that has trust and transparency, versus somebody saying this is not halal, or we don't trust this person and that person. So I think on a governmental level or an institutional level, if we can get everybody together and agree on some guidelines, that's the first step to having a solid infrastructure. I believe that the US has a great infrastructure for food and to supply everybody all the nutrition that they need. It's the intention with the work that we're doing. I was on the phone with the food bank in Colorado, and they're like, but we just don't have halal chicken. How are we supposed to get halal chicken to all of the people that are looking for halal? And I said, chicken is chicken. There's no sacred chicken that's coming from the sky that's saying that it's halal. It's how you slaughter it. And so, like, it's really creating the infrastructure and the intention around that infrastructure to support the needs of the community you're trying to serve. And that's probably one of the first steps. It's like with the intention and then understanding what the guidelines are to meet that intention. And then the training and the oversight will come later. But the US definitely has the infrastructure. We definitely can meet the needs, and it could become very cost effective. Where there's demand, there will be the supply will come with it. So that's kind of my 2 cents there.
Yeah, and just to kind of contribute to that as well, I think Asma, I think you're right on when it comes to a big role that government can play to really help to build this market is, to be that convener and to really help understand, not just for our own internal purposes, but to develop educational and resources and technical assistance for folks who want to get involved in the market. Because, as you pointed out, Asma, there is a significant market opportunity for folks here. And it's not just, we're not just going to people begging them to do something out of the goodness of their heart. There's money to be made here for folks. And I think by especially for halal, really demystifying the process, and for kosher as well, is just as you pointed out quite eloquently, there's substantial differences, unfortunately, in some, certainly not all, but in some situations, but really helping to demystify how it is, you can get involved in that market is really key to it. And that's certainly part of what we've identified, and what we're really looking at is how can we do that in a way that, again, as I said, holistically builds that market, and not only builds the production and supply side of things, but then also can help build the take-in part on the program side as well.
And often people talk to me about barriers to entry into halal, and they often think it's costs. And I said, no, it's not cost. It won't be cost prohibitive once people understand that there's a home market and there's ways to do it cost effectively. And like we said, supply and demand. It's really just starting with the conversation of building an intention up front. That's the barrier of bringing the conversation to the table up front and accepting that there's a population that has this need. They're food insufficient, they're food insecure. It has impacts on their development and performance in educational settings and in many other spaces. Once you accept that and bring that conversation to the table, then the doors start to open. And I think the barrier for many people is just even bringing that conversation to the table to begin with.
I mean, I could add a little bit on this, but I'm not so experienced as Asma Auntie. So the main thing was people didn't understand what halal was. Okay, and people thought it was like a specific for us that they need to buy, like open a store, like for us to get food from, or like there's a big things that they need to do to get halal. I was like, it's not even that big. As all we do is we have specific way that we slaughter the meat, and like we need to follow the rules that we have. and that will make it halal. So it's just like educating peoples on what is halal and what's the rule are. That's the only thing.
Thank you again for joining us today. Thank you, Ben. Thank you, Asma. Thank you, Radwan, and have a good afternoon.